All right, let's talk COVID-19 now. The province is now allowing pregnant and breastfeeding individuals to get the COVID-19 vaccine. Initially, the group was excluded by the Ministry of Health's recommendations that hindered access to that vaccine. City News reporter Faiza Amin joins us now with a very big decision here for expectant mothers following the research and potentially the higher risk of severe outcomes if you do contract COVID. Good morning to you, Faiza.
Good morning, Mel. So it now means that these individuals who are pregnant and breastfeeding can decide for themselves whether or not to get this COVID-19 vaccine. In some cases, they would have to sign consent forms and speak with their doctors, weighing out the health benefits and risks. Now, Dr. Tali Bogler, you'll hear from her in just a few moments. She tells me that there's already been a number of healthcare providers who have received this shot, who are pregnant, and we're only in phase 1 of vaccine distribution, but there are healthcare providers who are pregnant and breastfeeding, which means that they are on the front lines of this pandemic, working in hospitals and long-term care homes, which is why there was initial concern about this group being excluded from getting this vaccine. Now, we saw the provincial and national change in guidance, as you mentioned, but Dr. Tali Bogler says that she's still concerned some hospitals are not following this provincial directive, and she says leaving and excluding these populations out of getting the shots and making their own decisions, regardless of the fact of whether or not there's information on this, means that they're putting lives at risk. Here's more from Dr. Bogler.
It doesn't influence or communicate whatsoever with the person's DNA, potentially impacting the fetus. We know that vaccines in general are safe in pregnancy. So there's really no theoretical science-based reasons why these vaccines wouldn't be safe. That being said, it just hasn't been studied. So the risk of just excluding pregnant women from receiving the vaccine, potentially puts women's lives at stake, especially those with high risk of exposure.
Okay, interesting here, Faiza. So I guess the question is, why don't we have the data, the safety data on this population?
Well, as we know by now, a number of groups were left out the vaccine clinical trials. We have young kids, we have people who are immunocompromised, and also pregnant and breastfeeding individuals, which means that there's not that much data to gather from them. Dr. Bogler calls this a trickle-down effect. She says this is the heart of the problem. Despite the fact that pregnant and breastfeeding individuals were actually identified as a group that is highly at high risk of COVID-19. There is good news for folks at home. As we know, more data is being collected from pregnant and breastfeeding individuals when it comes to the COVID-19 vaccine. And so you folks at home who are pregnant and expecting and breastfeeding, come August, when the province is going to be allowing everyone to get this COVID-19 vaccine, we'll have more information. I'll tell you more about why this data and how this data is being collected tonight on City News at 5 and 6 as we look further into the vaccination of pregnant and breastfeeding individuals. Mel.
All right, an interesting report there, Faiza. Thank you so much. Appreciate your time today, too.